lecture I discuss about what is the pharmacology. Actually, the pharmacology is made by the two words. A Greek word pharmakon means drug, logos means study. It means study the effect of drug and the function of the living system. Receptor. What is receptor? Receptor is the specific type of molecule which having capacity to recognize the any molecule and give the response. ओके अनदर वर्ड में इसको ऐसे भी बोल सकते हैं कि रिसेप्टर हैविंग द कैपेसिटी टू affinity and give the extrinsic property. Okay. After the receptor is divided into four parts. One the G protein coupled receptor. Second is the enzymatic ionic channel receptor, enzymatic link receptor, and fourth is the steroid receptor. Yeah, you can known as nuclear receptor. Actually, G protein coupled receptor is a big receptor in which include the ionic channel and also the phospholipase and G protein coupled receptor also involved it. First is the ionic channel. Ionic channel is a flower-like structure that embedded inside of the membrane. Some portion is outside or some portion inside of the membrane. Okay, and the flower-like structure having the 5 parts, 2 alpha and 1 beta, gamma and delta. Specific agonists are bind to the superior portion of the upper portion of the receptor. Then configuration will be changed of the receptor and release and open the receptor. After then sodium, potassium, calcium chloride channel are influx from outside to inner side. That is a function of the ionic channel. After then you discuss, I would like to discuss about the G protein coupled receptor. G protein coupled receptor is made by the 7 heterohelix channel. Outer that is the amine group and inner is the carboxyl group. And inner side of the cytoplasm, G protein are floated. G protein means guanine protein attached to the inner side of the membrane of the receptor, and it having the 3 parts alpha, beta and gamma. After agonists are bind, then what will be happen? Agonists are bind, then activated the receptor after affinity attached to the activated receptor and that in GS receptor. Actually, the G protein is divided in 3-4 types in itself on the basis of attachment of guanine receptor. Okay, on the basis of attachment of the guanine receptor. If GS is, it means agonists are bind and induce the stimulation in which the cardiac contraction increases and smooth muscle healing. If GI means inhibitory, that influence the open the potassium channel. If GS is stimulating, then open the calcium channel. And if another type of the GQ hota hai, means inhibitory of the calcium channel. Actually, 3-4 types GS, GI and GU. If agonists are bind, then stimulating the GS receptor and after dissociation of GP and gamma and then influence to the GS receptor influence to the adenyl cyclase that attach the inner membrane of the membrane side and after then ATP convert into the cyclic AMP. Cyclic AMP is the second messenger. In similarly, the cyclic AMP is stimulated to the calcium channel that attached to the membrane and after influencing the calcium ion influx from outside to inner side and another cyclic AMP that another function the phosphorylation of protein kinase enzyme. That enzyme are induced to the other function of that body and also phosphorize the troponin protein. Actually, troponin protein is the specific type of protein that is present inside of the myocardial muscle after phosphorylation in presence of calcium ion. That contraction, force of contraction enhances of the myocardial muscle and cardiac output increases. Means GS after agonist bind, the cardiac output increases, contraction of myocardial muscle increases, and the heart rate also increases. And another way is what happens the smooth muscle. If the GS cyclic AMP phosphorize the protein kinase, then smooth muscles found in the phospholambin protein. Remember it, smooth muscle having the phospholamban protein and troponin protein in cardiac muscle. And after that, phosphorylation of phospholamban, and what will happen? The calcium ion restored in the smooth endoplasmic reticulum due to deficiency of smooth muscle. Smooth muscle contain calcium, then smooth muscle faster relax, and that is the relaxation occur in smooth muscle. It indicates if the agonist are bind the beta receptor, the cardiac muscle contract, cardiac output increase, but smooth muscle relax and smooth muscle effectively are relaxed. And if GI receptor means M2 receptor, GI means inhibitory receptor, GI receptor, if acetylcholine are bind to the receptor, then what will happen? The after dissociation of alpha, beta and gamma, beta alpha, that influence the opening of the potassium ion. Potassium, due to influx of the potassium ion, the inhibitory action, and after then conversion of cyclic CMP, dephosphorylation. After dephosphorylation, then what will happen? Phospholamban protein are contraction and release the calcium ion and occur the phospholamban protein and smooth muscle contract, and in the another direction the cardiac muscle are relaxed due to the decrease of the calcium ion and dephosphorylation of troponin protein. ओके, अब इसके बेसिस पे आप ये देखिए कि यदि रिसेप्टर मस्कुलर रिसेप्टर में बाइंड होने के बाद क्या होता है कि कार्डियक मसल रिलैक्स करती है, मानो कार्डियक हार्ट रेट, कार्डियक आउटपुट, ब्लड प्रेशर सब डिक्रीज हो जाता है, एंड इधर स्मूथ मसल्स या ग्लैंड सभी का कंट्रैक्शन होता है कार्डियक आउटपुट। तो इसके मैकेनिज्म के बेस पे ही हम फार्माकोलॉजिकल एक्शन एसिटाइलकोलिन का हम बता सकते हैं, क्योंकि इसमें क्या होता है कि बस एक बाइंड जीएस पे बाइंड होने के मस्कुलर रिसेप्टर M2 रिसेप्टर कार्डियक मसल में पाया जाता है। असल में मस्कुलर रिसेप्टर टू टाइप के एसिटाइलकोलिन रिसेप्टर टू टाइप के होते हैं, एक मस्कुलिनिक एक निकोटिनिक। मस्कुलिनिक रिसेप्टर आल्सो डिवाइडेड इन 5 टाइप, एंड that M2 receptor present in the cardiac muscle, then contract relaxation occur, and smooth muscles and glands having the M2 different type receptor, then what will happen after finally contraction occur in a smooth muscle, and due to the contraction the secretion, gland secretion increases, salivation increases, everything, and that are the pharmacological action are generally developed on the basis of binding to the receptor of the drug. This is all about the G protein coupled receptor. In the next time I will discuss about the another receptor. Thank you for your attention.